Hi, my name is Cherie Bradford, and today I'm going to talk to you about bipolar disorder. And so I'd like to start with different types of bipolar disorder. And we have bipolar disorder 1, where the client has at least one episode of mania alternating with major depression. And bipolar disorder 2, the client has one or more hypomanic episodes alternating with major depressive episodes. And then the third type is cyclothymic disorder, where the client has at least 2 years of repeated hypomanic manifestations that do not meet the criteria for hypomanic episodes, alternating with minor depressive episodes. And then behaviors shown with disorders are mania, hypomania, and rapid cycling. And mania is abnormally elevated mood, which can also be described as expansive or irritable, usually requires hospitalization. Hypomania is a less severe episode of mania that lasts at least 4 days, accompanied by 3 or more manifestations of mania. And hospitalization is not usually necessary. And then rapid cycling is 4 or more episodes of hypomania or acute mania in a 1-year span. And then expected findings in manic characteristics are labile mood with euphoria. Some of the expected findings, I'm not going to tell you all of them. Grandiose views of self and abilities, demanding and manipulative, poor judgment, attention seeking, decreased sleep, dislike of interference, and intolerance of criticism, so they don't like anybody interfering with what they're doing or telling them that they're not right. Depressive characteristics, flat or blunted or labile affect, so they show no effect at all. Affect, no expression. Lack of energy, physical reports of discomfort or pain, difficulty concentrating or focusing, decrease in personal hygiene, so they don't care whether they take care of themselves, loss or increase in appetite, or sleep disturbance. Client care for the different phases. So for acute phase, hospitalization can be required. Reduction of mania and client safety are the goals of the treatment. One-to-one supervision can be indicated for client safety. For continuation phase, which is remission of manifestations, that's what you want to see happen. Or that's the stage, remission of manifestations. Treatment is generally 4 to 9 months. Relapse prevention through education, medication, and adherence, and psychotherapy is the goal of this treatment. And then during the maintenance phase, the treatment is generally continues throughout the client's lifetime, and prevention of future manic episodes is the goal of that treatment. Medications that we usually see are antidepressants, which are your SSRIs. Fluoxetine is used to manage major depressive episodes. Your mood stabilizers, lithium carbonate, and anticonvulsants that act as mood stabilizers, including, I'm going to screw these up, sorry, valproate, lamotrigine, and carbamazepine. And then your anti-anxiety medications are your ANT-PAMs, so lorazepam and clonazepam. And then your second generation antipsychotic medications, these are the ones that I can't say, aripiprazole, clozapine, and ziprasidone. Sorry. Screening for bipolar disorder is it's not easy. They use a mood disorder questionnaire and the standardized tool that places mood progression on a continuum from hypomania to acute mania to delirious mania. And then therapeutic procedures, sometimes they can use, sometimes they will use the ECT, which is the electroconvulsive therapy, which can be used to subdue extreme manic behavior, especially when pharmacologic therapy such as lithium has not worked. Clients who are suicidal or those who have rapid cycling can benefit from this procedure. It's not used very often, but I have talked to some people who know or have family members that have used it, and it does work well for them. Let's see. Nursing care for patients with bipolar disorder. And the biggest thing is to focus on safety and maintaining physical health. So you want to provide a safe environment, assess the client regularly for suicidal ideation. So you want to interact with them and make sure to ask them if they feel like they want to kill themselves. I'm sorry, that you do have to ask them. Decrease stimulation without isolating them, because you want to interact with them. You want them to be able to interact with others. Implement frequent rest periods. Protect client from impulsive behavior. So you want to protect them from acting out towards others, and you want to protect them from self-harm. You want to administer medications as prescribed. Avoid power struggles, and you want to educate your client. You want to provide group and family, individual psychotherapy. This disorder requires long-term pharmacological and psychological support to prevent relapse. So educate the client about the importance of regular sleep and regular nutrition. Teach medication administration and adherence, because so many times they feel like once they are on their medications, they feel like they're starting to feel better, and wow, I don't need this medication anymore because I feel so much better, and so they quit taking it, and then they relapse. And we have to teach them to understand that they feel better because of the medication, so they have to keep taking the medication because that's what makes them feel better. And that's all I really have to report. I've really enjoyed this project. Thank you very much.